Hello, everybody. We're now going to be doing chapter 27. These are drug therapy for psychiatric problems. We're going to be talking about the drugs for those, and it starts on page 430 in the book. All right, so before we give any of these medications, it's very important to make sure we always obtain a list of all their meds. I say this 50 million times, prescription, over the counter, as well as herbal. Also very important to make sure that we get a full list of any allergies that they have, especially to medications. Another thing that we need to get beforehand is we need baseline vital signs, so blood pressure, heart rate, and respiratory rate. These people will be at risk for falls, so that's going to be something we need to be careful for. And if they already are falling, these medications can make that worse. So we need to know about falls history. If we do give these medications IV, we do need to monitor IV sites, so that's very important. Make sure we have a good IV site. And if they're of childbearing years, it is important to know if they're pregnant or going to become pregnant. So we have to make sure we check for that. But the most important thing that we have to do is that mental status, as well as if they have any suicidal ideations or plans, or any homicidal ideations with a plan, or are off, or onto a certain person. We need to know that stuff, but we need to know their mental status and if they're suicidal or if they're homicidal. So those are some things that we need to look for. Afterwards, when we give these meds, we're always checking those vital signs, especially it can change heart rhythms. We need to monitor for that. Safety is going to be a big thing because these medications can cause falls because of dizziness. So we do need to watch for that. They may need to sit a little bit before getting up and moving. And recheck their mental status, as well as if they're suicidal. Maybe things are going to get worse, or they have a plan now. And if we have suicidal tendencies or we have a plan, that is something we need to report to the physician ASAP. We're going to teach our patients on these medications to take as directed, follow up on their appointments. They need to follow up. Besides appointments with the medical doctor, they need to follow up with their psychiatric doctors as well as their counselors to make sure everything's going okay. But they also need to follow up with their medical physicians for follow-up. Report any side effects of these medications. If they miss a dose, take it as soon as possible, but of course never overdose or double dose on your meds. Watch operating heavy machinery because it can change, work on your mental, like dizziness and things like that. Change positions slowly because we don't want to cause injury because it can cause some dizziness, effects. Avoid alcohol at all costs because of the central nervous system depression and drowsiness that alcohol causes. We do not want them to drink alcohol if they're taking psychiatric drugs. That's a no-no. Report if on any of these medications before having surgical procedures or dental procedures. You should always tell the physician because it will affect the central nervous system, which will decrease the blood pressure, cause dizziness and drowsiness, and that's not what we want. And we always recommend that they wear a medical alert bracelet or an ID card. If anything ever happened to them and they were unable to talk, we have some information on them. So we're going to talk about different medical diagnosis, and we're going to talk about meds with them. Now you read up on that, read up on the medical stuff, what we're looking for, signs of depression, mania, all that, how it affects the nerves, and that's all important stuff that you need to go through before we start a lot of these medications, because there's a lot of stuff that we're going to be talking about. There's different types of depression out there. There can be major depression, dysthymia, bipolar disorders. There's different types of depression that we have to. On page 433, box 27.1 are symptoms of depression that you kind of need to be aware of. Because when you start taking care of patients, when you see these are things that you're going to be alert on and report. Also, on that same page, box 27.2 is symptoms of mania. Now, if you ever take care of a manic patient, you will never forget taking care of a manic patient because it's totally opposite of someone who is depressed, not doing anything. And then you get the manic patient who is out there yelling, screaming all over the place. So look at the different signs and symptoms for that. And then on page 434, table 27.1, are the factors that are associated with depression. So you can look at those different things and read that up on that. But before we diagnose a patient with any psychiatric problems, we have to make sure that they are medically okay. So when I say medically okay, we're going to do a complete workup on them. We're going to check their lab work because maybe it's lab work results that are off. Sometimes thyroid problems. Think about it. Everything slows down when you have hypothyroidism. Remember, like the turtle, everything's slow, and that can cause people to be depressed. They're not doing much. They're hanging out. So we have to make sure they're medically okay. So we're going to be checking that out before we decide to diagnose anybody with a psychiatric problem. We have to remember they do need counseling and psychotherapy as well as antidepressant drugs. That's a big thing. They need to have therapy. It's a combination of treatment. It's not just drugs, but they need to be able to talk about things and counseling. So that's important. So we're going to talk about the antidepressant drugs. There are two types of antidepressant drugs we're going to be talking about. We have SSRIs, and that is our selective serotonin reuptake inhibitors. And then we have our TCAs, which are our tricyclic, that was a tongue tire for me, antidepressants. So those are the two types of antidepressant drugs we're going to talk about. Your SSRIs have the fewer side effects. So those are the ones you're going to see more often used, but they will use TCAs too, but they will try to do SSRIs first because of the fewer side effects. Very important to remember, and people don't realize this, that it can take as long as 8 weeks for symptoms to improve. So about 2 to 8 weeks to see improvement when you start these medications. It's not instant gratification. You're not going to feel 100% better after the first dose. It will take as long as 8 weeks. So about 2 to 8 weeks, you're going to see some improvement. And it may take as long as 8 weeks to actually see the symptoms improve. So those are some things you have to remember, and that's very important. Another thing that's very important, depression can be chronic. Okay, and patients who are on these meds, they need to take them even when the symptoms are gone. Okay, depression can be chronic, like I said. Sometimes it's not. It could just be something, a situational problem. And once that situation is cleared up, they're fine. But it can be a chronic problem for patients. And they need to remember, even though I'm feeling good, I'm going to take this medication and continue to take it, because if not, they can have problems. But like I said, they have to take it as long as 8 weeks for symptoms to improve. So about 2 to 8 weeks to see improvement. So on page 436, we're going to look at the medications that we have. And like I said, there are a lot of meds. Your first topic is your SSRIs. And on there, citalopram or Celex is a big one that we give. Escitalopram or Lexapro, fluoxetine or Prozac, paroxetine or Paxil, and sertraline or Zoloft. Every single one of the SSRIs I've given. They are common ones out there. It's just something that you're going to see, and you're going to have to try to remember that those are the psychiatric ones. For your TCIs, amitriptyline, Elavil, I don't give much of that. That's probably the biggest one we give out there of the TCAs, is the amitriptyline or Elavil. That's probably it. And when we're going to talk about the serotonin and the norepinephrine reuptake inhibitors, duloxetine again, Cymbalta, that's a big one, and venlafaxine Effexor, that's another one that we give. And then the norepinephrine and dopamine reuptake inhibitors, bupropion or Wellbutrin. And then there's the combined reuptake inhibitors, mirtazapine, which is Remeron, that's probably biggest one, and trazodone, Deserel. Those are probably the biggest ones that we give out there. So like I said, I've seen majority of those. There's maybe one or two that I have not seen used, but they are out there, and a lot of people, those are the most common ones that I've seen. So let's talk about the common side effects, especially for our SSRIs. And these are the antidepressant drugs, and you can see these on page 437, but I'm going to go through. So the common side effects, of course, a lot of neurological things. That's why it's very important to know what their normal mental status is. So drowsiness, dizziness, fatigue, insomnia. They can have GI upset, so they can have nausea and diarrhea, they can have dyspepsia, and they can have a lot of flatulence, which is gas. They can become male population, they can become impotent and have decreased sexual activity, so that can be a problem. And venlafaxine, which is Effexor, can actually increase blood pressure. So that's why it's important to make sure we get vital signs and monitor that. There's tons and tons of other side effects that occur. But those ones are the most common ones. But there's other side effects like apathy, anxiety, nervousness, confusion, headaches, weakness, abdominal pain, anorexia, dry mouth, increased salivation, increased sweating, weight gain, and tremors. Whew, that was a lot. But remember, just go over your the common side effects that occur. But no, other things can happen to these patients. These medications, especially at the beginning, you have to watch them very closely and especially monitor if they're suicidal or homicidal and they start getting worse and having plans in that. Now, so those are your common side effects for your SSRI drugs. Okay, and these are the ones that have less side effects. Now, your TCA drugs, what you're going to see for them is going to be lethargy, sedation, drowsiness, fatigue, blurred vision, dry eyes, dry mouth, hypotension, constipation. Your TCA drugs will dry you up. They do have a lot of drying effects, and you're going to see that. Um, but they do have more and more side effects, more bad side effects, a lot of neurological things than your SSRI drugs. So the more side effects the first few days, but you're going to see, but they should improve as time goes. So you're going to see a lot of those things at the beginning, but they should improve. If not, then we need to talk to a physician about it. But remember, it's going to take about 8 weeks to see the big improvements. So we'll see improvement if people will see from 2 to 8 weeks. It's not instant gratification. And a lot of times we see people come in saying, oh, I started on these medications and I'm so depressed and I'm not feeling good. And then when you find out that they're on certain medications, it's like, well, a lot of teaching that you're not going to feel great right away. It's going to take some time, but get in and talk with your counselor right now. Maybe they can help you talk some things through. And it's very, very hard on them because we're in a world of we want instant gratification. I know I do. Everybody wants instant gratification. We want things done right there, right now. But with these drugs, it does not happen like that. All right, so adverse effects we're going to talk about, especially with our TCAs, we're going to see, that's why we don't use them that often because those are the ones that we're going to see a lot of the worst stuff for. All right, so example, amitriptyline, which is Elavil, can actually cause cardiac effects. It can cause ventricular dysrhythmias. It can cause asystole, which is the flat line. So that's why when you're on TCAs, it's very important to check heart rate and rhythm before, during, after we take these medications. So it's very important to teach the patients how to check their heart rate and feel their pulses. Does it feel right? Is it irregular? Because those are some things that we need to know. Seizures, especially if you're taking venlafaxine, which is Effexor, duloxetine, and bupropion. Those are some things that we have to be very cautious with because it can cause seizures. Another thing with adverse effects, neutropenia. Especially if you're on mirtazapine, you have to check for the decrease in white blood cells because it will suppress the bone marrow, and we know what happens when bone marrow suppression, and that puts the patient at risk for infection. It can cause liver failure or toxicity, especially if you're on Nefaxidome, and suicidal thoughts can increase with children, adolescents, and young adults, and that is an adverse effect. Suicidal thoughts can actually increase in our younger population, from children to the younger adults. They can cause a lot of allergic reactions, so patients can complain of chest pain, increased heart rhythms, they can change, irregular heart rhythms, shortness of breath. They can have fever, hives, and rashes. They can be itchy, problems swallowing. They can have some swelling. Decreased coordination, tremors of the hands, dizzy, lightheaded, and as well as the suicidal thoughts. So there's a lot of different reactions out there. So besides, like having the seizures, neutropenia is a big one we have to remember. Another big one out there is serotonin syndrome. And this is one that you got to know. You have to know it. But serotonin syndrome is a big thing. These are when levels are high. And when levels are high, you will get signs and symptoms of anxiety. These patients are agitated, sweating, confused. They can have tremors of the body. They're very restless. They have a lack of coordination and rapid heart rates. So those are signs and symptoms of serotonin syndrome, which is considered an adverse effect for these meds, and they do occur. You have to monitor out for that. So before we give these meds, we should always know, is there a history of depression? Is there a family history of depression? Has anyone, is there suicide involved? Is there homicidal issues? Do they want to hurt other people? We need to know some of these things. St. John's wort. We do not want to take St. John's wort, especially while they're on antidepressants, because it can affect the medication, so no St. John's wort. If you're on any TCAs and you smoke, it will actually decrease the effectiveness of the drug. So you cannot smoke if you're on TCAs because it decreases the effectiveness. Now, there's different types of Wellbutrin. There's Wellbutrin SR and Wellbutrin XL. These are, the SR would be sustained release, the XL is extended release. You cannot interchange these, okay? They are different, and you want to make sure that they get the correct one. The Wellbutrin SR is usually ordered 2 times a day, at least 8 hours apart, and your Wellbutrin XL is ordered usually daily. So you cannot interchange your Wellbutrin SR or your Wellbutrin XL. Whatever the doctor orders, you must get that medication. Afterwards, we're going to reassess the mental status. We're going to be monitoring for any signs of depression or suicidal thoughts. We're going to watch for the side effects and adverse effects and remind patients they cannot drink alcohol because it will increase the side effects like dizziness, can cause a lot of injury. So they cannot drink alcohol with their psychiatric drugs. We're going to teach the patient, start with a low dose, and they're going to gradually build up. We want to make sure they know that these meds will cure the symptoms, but not the disease. Unless it's a medical issue, we can solve that. But otherwise, once that medical issue is okay, then the disease will go away. But majority of the time, if it's psychiatric, we cannot cure the disease. It's only going to help with the symptoms. It will take 2 to 8 weeks before symptoms will improve. Make sure we take, even if we're feeling good, if it's like, I'm feeling good, I don't feel depressed today, still take your pill. And also, it's very important to gradually decrease the dose if you're going to discontinue the medication. Do not stop it suddenly. It can cause so many bad issues. Now, we do know these medications can dry your mouth. So again, good oral hygiene, mouth rinses are going to be very important. Now, your SSRIs, they do recommend sometimes taking in the morning or in the evening if it's a daily dose. You can't take any SSRIs and TCAs or other antidepressants for 14 days after stopping, okay? Because it's going to cause a lot of issues, especially if you're stopping your MAOI, your monoamine oxyhydrase inhibitors, because what it will do is cause serotonin syndrome, and that's a bad thing. Okay, so if you can't take any SSRIs, TCAs, or other antidepressant drugs for 14 days after stopping your MAOI inhibitors, because it will cause that serotonin syndrome. And we already talked about the symptoms of serotonin, the confusion, agitation, restlessness, stomach problems, increased temperatures and blood pressures, and seizures. So we do not want that. So that's important to know. Pediatric populations, drugs can increase suicidal thoughts. We do need to monitor them because kids cannot express things a lot of times. Even with the older youth, they don't like to talk about it. And sometimes they will do things and leave notes in that. So we have to monitor, watch them very closely. Fluoxetine or Prozac will actually cause excitement, restlessness, irritability, and problem sleeping. So that is not uncommon. If they do have a lot of problems sleeping, sometimes they will need a lower dose. So they need to notify the doctor so the doctor can adjust their medication or maybe change it if it's not helping. Venlafaxine or Effexor can actually slow the growth and cause weight gain. So that may not be a good drug choice for them, especially if they're still growing. Pregnant or breastfeeding population, paroxetine or Paxil is a no-go. They said to avoid that. And your SSRIs do pass through the breast milk, so breastfeeding is not recommended, of course, but always talk to your OBGYN about that. In our older population, their doses should be lower. Remember they are going to metabolize the drugs slowly because they have kidney and liver impairment as they get older. So those are some things that they do need to monitor. So that is information on when we're talking about depression, especially the SSRIs and our TCAs. And we're going to be using more SSRIs before we use TCAs. So that's done with that. Now, the next thing we're going to talk about is anxiety, and that starts on page 438 in the book. Now, anxiety has many, many different aspects. We have panic disorders, which is panic attacks, generalized anxiety disorders, phobic disorders, obsessive compulsive disorders, your OCDs, your PTSDs, your post-traumatic stress disorders. So there's a lot of different anxiety disorders out there that people may have. On page 439, box 27.3, look at the signs and symptoms of anxiety and how detrimental it could be on an individual having an anxiety attack. And then on page 440, box 27.4, the causes and external factors that are associated with having anxiety. So look at those things too, because there's different things out there. And right now, we're probably going through a lot of that because, with this coronavirus going on. So we need to watch for that. We do have to carefully diagnose because, like I said, it's very important to check the thyroid because hyperthyroidism symptoms can also be found in anxiety disorders. So that's why it's important to check the thyroid gland and make sure. Anti-anxiety drugs or anti-oxylytics or minor tranquilizers can cause issues with anxiety. It can cause sedation or sleep. It can cause dependency when you take a long period of time. A lot of anti-anxiety drugs are very drug addictive. They can cause a lot of addiction. So we have to watch. They will depend on them a lot. So on page 441 is our common ones. And let's see, if you notice, benzodiazepines are very, very highly addictive. And if you know with your benzos, you do have to watch very closely. But these are the medications that you're going to be watching for. And remember, benzodiazepines, we can actually pick up in a urine drug screen if they're on benzos or not. But alprazolam, which is Xanax, clonazepam, Klonopin, clorazepate. We don't really use much of that one. We do see the chlordiazepoxide, which is Librium. We sometimes see that. Diazepam or Valium, yes, we see many of that. The Razapam or Ativan, that is actually what we give in the hospital setting for people who come in with anxiety. They will give them a dose of lorazepam or Ativan to help with that. And then oxazepam or Serax, we don't use too much of that. And for the anxiolytics ones, Buspirone, Buspar, we do use a lot of that. So that's not uncommon for those. Now, you have to remember with your benzodiazepines, and this is important, very important, it will act within 30 minutes and can be given as needed. That's why when people come in to the emergency room and they're having anxiety, that's why we give a benzo, because it's fast acting and they usually feel good. They can send them home with a couple of pills and take it as needed. But it's only as a needed basis. It's not something going to be straight because benzodiazepines are very addictive. And we talked about that back when we were talking about the other chapters, how addictive they can be. Now, if you're on SSRIs for anxiety, it can take 3 to 5 weeks to control the anxiety. Remember, SSRIs take some time to kick in. Benzodiazepines, another thing important, it will decrease the symptoms of alcohol withdrawal and prevent those delirium tremors, those DTs that we talk about. So a lot of times people that come in and they're going through alcohol withdrawal, we will actually put them on Ativan. We will look at a scale, it's called the CWA scale, and we will actually go through the list. Are they having tremors? Are they hallucinating? And we'll ask them do you feel anxious? And we'll ask them these questions, and it will determine how much Ativan we give them. But we actually give lorazepam or Ativan to help with controlling of alcoholic withdrawal and to prevent those DTs from occurring. They do recommend if you're taking SSRIs to take them in the morning or evening if it's a daily dose. Take it around the same time every day. You can't take any SSRIs, TCAs, or other antidepressants for 14 days after stopping the MAOIs. So we have to remember that. Got to watch those MAOIs again, because, like I said, we already talked, because it will cause that serotonin syndrome. So we did talk about that. So we do need to monitor for that. Another thing is our dopamine, our central nervous system depressants, are benzodiazepines, so they can cause CNS depression, and it will quiet the brain, which can, cause some lead to decreased anxiety. So that's why we like our benzos, because it will cause CNS depression, and cause them to relax more. Now, they do have nasty side effects with them. Benzos have a lot of central nervous system issues: drowsiness, dizziness, lightheadedness, fatigue, ataxia, so their balance is off, unsteadiness, nervousness, irritability, problems concentrating. They get the glassy-eyed appearance. Um, they're changing their heart rates and blood pressures. Their bowel function can change. Rashes. If you give it IM, it can cause some pain at the injection site, of course. But there's so many other side effects. But like I said, go with the ones majorly on page 442. That did. But it causes a lot of neurological problems because it's affecting that brain. It's actually quieting it down, making it relax so the patient can be less anxious. But there's so many other side effects, and I'm going to go through those because there's tons of them. Sleepiness, depression, lethargy, apathy, memory impairment, disorientation, amnesia, deliriums, headaches, slurred speech, behavioral changes, euphoria, unable to perform complex mental function. So a lot of neurological issues can cause with these medications, with your benzos. If you're on buspirone, it can cause dizziness and drowsiness. But like I said, there are so many side effects that occur with these meds. Now, adverse effects. Benzodiazepines can cause seizures and coma. Okay. And if you stop the medication, it can cause seizures. Buspirone can cause hallucinations and heart failure. If you stop benzos, if you're on benzodiazepines for a period of time, if you stop benzodiazepines, you are going to go through withdrawal symptoms. And if you go through withdrawal symptoms, you're going to be nervousness, restlessness, you're going to have tremors, weakness and seizures, you're dehydrated, you have deliriums, insomnia, confusion, and hallucinations. So there's a lot of stuff with benzodiazepines. And remember, the reversal for benzos is what? Ramazicon. So if someone overdoses on benzodiazepines, we give Ramazicon. That is the reversal, and we talked about that in the back chapters. Clonazepam or Klonopin for adverse effects can cause suicidal ideation, so that's a bad thing. So after we give these meds, we're always going to monitor the effectiveness. We want to take as prescribed because it can cause dependency, so we do need to watch for signs and symptoms of dependency. We're going to teach the patient take as prescribed, avoid alcohol or sleeping pills or prescription pain pills, not taking them at the same time of anxiety pills because we want to prevent severe central nervous system depression. We want to wean the med off slowly to prevent withdrawal, because if they do withdraw, it's going to be sweating, vomiting, muscle cramps, tremors, and actually the big one that we're concerned about is seizures. They can have seizures when they're going off of their benzos. We're going to teach signs of dependency. These meds are very addictive. You'd be amazed how many people come in. I'm anxious. I need my Ativan. I need my lorazepam. I need it now. And a lot of times it's very sad to see, but it is a very addictive drug. We don't want to take our benzos with antacids. You have to take them 2 hours, what did we say, 1 hour before, 2 hours after we're going with antacids. No grapefruit or grapefruit juice, especially if you're taking alprazolam, which is Xanax, diazepam, which is Valium, midazolam, which is Versed, thiazolam, which is Halcion, or buspirone, which is Buspar, because it will actually increase blood concentration of the thing. So no grapefruit juice. Just say your psych drugs, no grapefruit juice. Pediatric population, clonazepam can decrease mental and physical growth, so we don't use if they're under the age of 18. With panic attacks, we're not sure. So that's something to talk with the pediatrician. Pregnant breastfeeding, benzos will cause dependency in the fetus, and they will go through withdrawal after birth. So benzodiazepine is probably not the best choice for your pregnant population. Don't breastfeed if you're on benzos. Um, and some of these can cause some birth defects. So we're always going to discuss our concerns with the OBGYN. And our older population, more sensitive to the side effects, lower doses. We have to monitor for respiratory depression, falls and injury. We want to make sure we change position slowly, monitor the cognitive and mental alertness. It can cause increased drowsiness. We have to monitor them operating heavy machinery. Um, Chlordiazepoxide or in chloroxamate, they're not recommended because of the long half-life on our older population. So we do have to watch for them. So that is anxiety. Now, the next thing we're going to talk about is psychosis. And psychosis is a fun thing. And that starts on 443. These people are like, wow, they exhaust me taking care of someone in a psychotic episode. And you have to be very careful because these patients do not realize what they're doing a lot of times, and you have to monitor them. So when we're talking about psychosis, you can see the symptoms of psychosis on page 443 in the box 27.5. And then there's potential causes of psychosis, and that is on page 444, box 27.3. So those are some things that you can monitor for. Now we're going to be looking at the drugs on page 445. And like I said, I've probably given every single one of those drugs out there. There are all common medications that we give, and they do cause a lot of issues. Now, side effects, and that's on page 445. Sedation, drowsiness, dizziness with positional changes, lethargy, restlessness, insomnia, GI upset like nausea, vomiting, diarrhea, hand tremors, like especially when you're on lithium. So a lot of neurological effects that it's going to cause. It can cause other side effects like agitation, headache, decreased blood pressure, tachycardia, muscle spasms, tremors, weakness, dry mouth, dry eyes, blurred vision, weight gain, photosensitivity, and constipation. So it does cause other side effects, but the big ones are a lot of mental things that are occurring. Adverse effects, tardive dyskinesia. We talked about tardive dyskinesia, the rolling of the tongue, the puffing of the cheeks. Those things drive me crazy and I just stare. If tardive dyskinesia signs or symptoms, we need to remember, report that ASAP, because if we don't catch it within that year, they will have long-term effects and we will not be able to change it. So they need to report that as soon as they get effects so they can work on that, because we don't want them to have long-term effects of tardive dyskinesia. Adverse effects, seizures, especially if they're on clozapine, haloperidine, olanzapine, quetiapine, and lithium can all cause seizures, adverse effects. That neuroleptic malignant syndrome, and we always want to monitor if they have a rapid increase in their temperature. We talked about neuroleptic malignant syndrome. Neutropenia can occur, decreased white blood cells. Myocarditis, especially if you're on clozapine. And risk of death to older adults with dementia, especially if we're taking like Seroquel or risperidone. It can actually cause death. So we have to be very cautious, definitely with that one. Before we give, we're going to check our daily intake and outputs and weights, monitor their bowel function, because some of these can cause some issues. We're going to have them drink more water because they can become constipated, monitor their mental status for any changes, watch for complaints of suicidal ideation, and we're going to give it with food if it upsets the stomach. Afterwards, we're always monitoring intake and output and daily weight, monitoring their bowel pattern, constipation. We want them to drink more fluids. We're going to monitor their mental status for any changes of anything, report any suicidal ideations, watch for sedation, and we're going to give with food if it upsets the stomach. Teach the patients, we're going to start with low doses and increase as needed until therapeutic range. We're going to teach about the side effects and adverse effects. Report immediately if they have sore throat, unusual bleeding or bruising, rashes or tremors. They have to remember they need psychotherapy, and they need to avoid alcohol. They need to increase their activity and their fluid intake, increase their fiber, because that will help prevent constipation. Don't take with antacids 1 hour before, 2 hours after. Take with food if it upsets the stomach. Prochlorperazine, which is compazine, which is actually what we use for nausea. We can actually use it for psych. Remember, it is normal to have that pink or reddish brown urine. That's normal. So if they're on prochlorperazine or compazine, protect yourself from the sun. Some of these are photosensitivity. Dry mouth, good oral hygiene. Mouth rinses, sugarless gum. Thiopine, which is Seroquel, impairs body temperature, so we have to watch that. And avoid grapefruit and grapefruit juice with these meds. Pediatric population, you're going to see a lot of side effects and adverse effects, so you have to watch because they're very sensitive to the medications. Pregnant breastfeeding, it does cross the placenta. They don't recommend breastfeeding, and no lithium during pregnancy. Always talk to your OBGYN. And last but not least, our older population. They're going to be at risk for side effects and adverse effects. Start them on lower doses. Chlorpromazine or Thorazine, rapid fall in blood pressure, especially with positional changes. So safety is going to be a big concern for them. They need to sit a little bit before they get up. And lithium. Lithium will cause excessive urination in our older population. They can become dehydrated. We want them to make sure they drink the same amounts of fluid daily, report if they're nauseated or if they can't keep fluids down, and report if they have any weight loss of 6 pounds in 1 week. So that is the psychiatric aspect of this chapter on page chapter 27. A lot of information, a lot of stuff on the drugs, but very important to just remember that you have to monitor these patients very closely. And again, if you have any concerns, you know where to find me. Guys, have a good one.